Breastfeeding is the best possible source of nutrition you can provide for your baby. Benefits for the baby include decrease in sudden infant death syndrome, or SIDS, decreased risk of developing respiratory illnesses, decreased risk of tummy issues like colic or diarrhea, decreased risk of developing childhood obesity, and it helps to prevent ear infections. There are also benefits for the mom, like a decreased risk of developing certain types of maternal cancer, like uterine, breast, and ovarian. If you're a diabetic, breastfeeding can decrease the amount of insulin needed for your body. Breastfeeding also helps the uterus contract down and stop postpartum bleeding in the immediate postpartum period. Exclusive breastfeeding means only feeding your baby breast milk without any other food or drink. The American Academy of Pediatrics recommends exclusively breastfeeding your baby for the first 6 months. The World Health Organization also recommends exclusive breastfeeding for the first 6 months, then offering complementary foods until the child is 2. No matter your feeding preferences, we recommend rooming in. This allows parents to learn the baby's feeding cues, cries, behaviors, and comfort technique preferences. We recommend skin-to-skin contact where the baby, wearing only a diaper, is held directly against your skin. Skin-to-skin can help them smell you, smell the colostrum, which in turn can help coax a feeding. Avoid pacifiers and artificial nipples during this time to eliminate confusion. Artificial nipples provide a type of latch that is completely different than the latch baby will have with the breast. Babies may have difficulty switching between different types of nipples. Formula may also confuse the baby, leaving them unable to latch at the breast, so formula is not recommended unless medically necessary. You can find support through many options. Talk with your friends, attend a support group, or talk to other mothers that have breastfed. You can always call us here at Forest General. We have a certified lactation consultant available to help guide you through your breastfeeding journey. Breast milk works on supply and demand. The more your baby empties your breast, the more milk you're going to make long term. You need to get at least 8 feedings or stimulations to the breast every 24 hours. This includes during the night. Once your baby is a couple weeks old, breastfeeding should be routine. If you start backing off feedings during the night, your body will slowly get the message that less milk is needed and you'll start backing up on production. Even as your baby gets older, you need at least 8 feedings every 24 hours to keep up production. Your body will make 3 different types of breast milk. The first type of milk you're going to make is colostrum or newborn milk, commonly referred to as liquid gold. This is what your baby will get during the first few days of life. Colostrum, which may be clear, white, or yellow, is full of fat, proteins, and everything your baby needs in those first few days. Transitional milk. This is made over the next few days as your milk levels are ramping up in volume, fat content, protein, and calories. Mature milk. Mature milk contains a high level of water to help fill your baby up and allow feedings to be spaced out longer. At this stage, you should be feeding every 2 to 3 hours instead of every 30 minutes to an hour. Mature milk has many immune-boosting properties that will last throughout the rest of your breastfeeding journey. Hand expression means physically expressing your milk by hand. Hand expression is useful for getting your baby latched. If you squeeze out a couple drops, your baby can smell it, taste it, and remember what they're supposed to do. If your baby's too fussy, you can hand express into a spoon or a medicine cup and spoon feed or cup feed your baby. To hand express, make sure to wash your hands before you start. As with other types of feeding, you may need to support your breast, especially if you have larger breasts. Take your hand, place a finger on either side of the areola, and press back against the chest wall. Put your fingers together. That way, you're grasping the milk up, and you're going to roll your fingers forward to express the milk. You want to make sure you aren't sliding your hand around because you can lose your milk duct. So lift, press back together, and roll forward. Breastfeeding can sometimes seem overwhelming, but don't get discouraged. Find support in friends, other mothers, mommy groups, or call our certified lactation consultants here at Forest General. It's important to prioritize your health and the health of your baby. Don't hesitate to contact your healthcare provider if you have any questions or concerns. Your obstetrician gynecologist is committed to supporting you throughout your journey. To learn more about Forest General Hospital's Women and Children's Services, visit www.forestgeneral.org/women.